So I talked a little bit about this. So we've been working with low-level light treatment as an adjunct to IPL. So if energy is what we need to get the cells working, what we're missing is how can these patients get energy without having to come to the clinic? So I developed low-level light treatment. So it's just like IPL in the sense that you have to put it directly where you want that energy to go. So you're applying that. So we've tried blue, we've tried red, we've tried infrared. They all work to some extent. Advantage of blue is you may get some bacterial killing. Red in the 600 to 700 nanometer, just like IPL, is the most effective in terms of photobiomodulation of the glands. Infrared doesn't do anything to the meibomian glands, but symptomatically, patients like infrared, and there's studies that are showing that infrared can stimulate the trigeminal. So the latest Q is about 1/3 the energy of an IPL system, so it's about 6 joules that you're getting to these patients. If you read the study that led to the patent, and it's published, is these patients have to use this at least twice a week at home. Since this is metal, and we needed to use metal because the energy is higher, so we couldn't use plastic. We don't want patients to get any kind of burn, so we just put a little rubber sleeve. So if you haven't heard this term or you're not using this term, photobiomodulation, where we actually use light to stimulate the mitochondria of cells to work better. So photobiomodulation. So low-level light and IPL work by photobiomodulation. Too much energy, not good. Too little energy, not good. You see photobiomodulation everywhere now. Orthopedic surgeons are using infrared to help bones and ligaments and cartilage heal quicker. You're seeing infrared, which is in the higher levels of red and invisible in the 900 to 1,000 nanometers. You're seeing that used in AMD for AMD patients. You see blue light used for acne and for other skin conditions, and we're using red for meibomian glands. So if we didn't have photobiomodulations, these glands would not come back. And again, tried everything that is out there, and I find the only thing that can bring meibomian glands back is light. The reason why I show this meibography, let's see here. The reason why I show this meibography, you see these little black dots here? Can you see that? Okay. So this is a patient that had probing. And what actually happened in the probing is that since the glands were in 90-degree angles, when they probed, they actually transected the meibomian gland. We now have 10 patients that have seen that. So how many people here probe? Any probers here? Good. Yeah, this is something that's in the US where they're taking a little metal probe and they're actually going through the meibomian glands thinking that that improves it. And I can tell you that Hamra at Harvard did a study looking at probing, and he found no improvement in the signs and minimal improvement in symptoms for only 2 to 3 weeks. So I'm glad this isn't here in Europe because it's not a good procedure and you can get some severe adverse events.
So what are the black spots?
What's that?
What are the spots? How do you interpret these spots?
So
the black.
They're using blood clots.
Oh, okay.
So this patient came to me right after they were probed, and I've had patients that. This patient came to me right after they were probed. They had these blood spots on the conjunctiva. I should have shown a picture of what that looks like, little red spots, but it shows up on my biography. And then heat shock proteins. These wavelengths of light actually, when they generate heat in the dermis, not epidermal heat, but in the dermis, they will stimulate heat shock proteins. And the most studied heat shock protein is heat shock protein 70. So if you give them heat enough to stimulate, but not enough to burn, you can get the DNA of these patients working better.
Can I ask a question about the effect on pain? Because I think I have the feeling that IPL is very efficient in some patients with neuropathic pain. And it works very quickly. Usually it does last for 1 or 2 weeks and no more. But the patient say, okay, I have still my dry eye, but I don't feel the pain anymore. So what could be the mechanism? Because on the ocular surface, the breakup time is the same, and no parameter did change.
Yeah, and that's the infrared. So there's a little bit of infrared when we're doing IPL. So we're putting a filter. I like a 590 filter or 600 filter so I can get the red that we need at 600 to 700. But you're getting some infrared. And infrared has been shown to decrease, it's like capsaicin. It decreases the nerve impulses for pain. So that's why you get a little bit of an effect, but it's short term.